Hi everybody, thank you for being here today. My name is Theron Mrohs and I'm a student here at Somerset Physical Therapy completing my internship. While I've been here, I've noticed how often shoulder injuries come up, especially with athletes and older individuals recovering from things like rotator cuff repairs, impingement issues, or labrum tears. And what really stood out to me was a gap in patient resources. There's a good support for beginners, but not a lot for people who are further along in their rehabilitation process and ready for more advanced work at home. That's what led me to create the project that I'll be sharing with you guys today, an evidence-based, easy to follow, at-home shoulder rehabilitation packet designed specifically for the more advanced stage of recovery. Somerset had some basic materials for new patients, but there wasn't a clear progression once they were doing better, especially for overhead athletes like baseball players or swimmers who needed to return to high-demand shoulder movements. So my goal became creating a tool that physical therapists could hand to patients nearing discharge so they could keep making safe, structured progress at home. To make sure I wasn't just guessing, I started by researching shoulder rehab protocols, looking at both academic and clinical practices. Some of the most important takeaways came from studies like Theron and Yesley Prack, who showed that posterior capsule stretching can significantly improve range of motion and function, along with Matthey and Linter, who found that in many throwing athletes, posterior capsule work can actually outperform surgery for labral issues. That research guided the first part of my packet. If you'd like to look at your copy now, you'll see that the first section is focused more on stretching and mobility rather than strengthening exercises. Let's take a look at the first section together. The first stretch you'll see is the sleeper stretch. This is excellent for improving internal rotation, especially in overhead athletes. I included photos and step-by-step instructions and a few common cues to avoid improper form. Following this, I included the crossbody stretch, which targets the posterior shoulder and helps with general capsule tightness. And finally, for the last portion of the stretching and mobility, I added the angel stretch, which not only improves range, but also corrects posture and scapular motion. This helps reduce impingement risks long term. Next, you'll see the section on scapular control and strengthening. Research shows that scapular dysfunction is a root cause of many shoulder problems, especially in athletes. Zhang and Zhao, for example, found that adding scapular-focused exercises significantly improved outcomes in both strength, daily movement, and day-to-day life. In this portion of the packet, you'll see exercises like scapular elevation and depression, tipping movements, and basic retraction and protraction drills to engage stabilizing muscles like the serratus anterior. There's also a variety more of exercises in my packet that I will demonstrate personally for you guys towards the end of this video. These movements are low risk but high value, and they help build foundational control. After selecting the exercises, I worked with the clinic's lead PT to make sure everything was aligned with their current treatment philosophy. I then personally tested every single exercise myself, took the photos you see in the packet, and wrote clear, simple instructions that anyone at any knowledge level would be able to understand. This actually turned out to be one of the biggest challenges I had while creating the packet, writing the directions that anyone could follow, regardless of their fitness level or background. After creating the packet and finding the right wording, I asked a few friends and family members to try and follow the packet without seeing the photos I had included in the packet, and I made adjustments to the wording and phrases until they could do the movements safely and confidently by themselves. I want to briefly mention ethics. All photos were taken by me using myself as the model, so there are no patient images or privacy concerns. And for the testing portion, I fully explained everything and got verbal consent before asking others to try out the exercises. It was important to me that everything be respectful and voluntary. The final version of the packet is what you're holding now. It's been well received by the clinic so far, and they've already begun using it with some patients who are nearing the end of formal physical therapy sessions. It gives patients a roadmap to continue progressing on their own with clear instructions, safe exercises, and a strong evidence base behind it. This project has taught me a lot. I learned how to bridge the gap between academic research and real-world application, the importance of simple, accessible language, and how important it is to induce exercises that not only work, but that patients will actually understand and do. I also gained confidence in my ability to build something from scratch that could have a real impact on people's health and recovery back to their day-to-day lives. One idea I'd like to recommend to the clinic is to expand this kind of packet to other common injuries, like for knees, low back, or ankles. Even a basic packet tailored to those areas could help reduce injury and give patients a structured plan post-therapy. If I had more time, I'd also consider breaking the shoulder packet into smaller pieces, maybe with one version just for rotator cuff injuries and another specifically for labrum tears and/or impingement problems. I'm proud to have created something that's not only useful, but usable, and that fills a gap in patient care. This process has taught me about research, clinical reasoning, ethics, and patient communication. All things I'd like to carry forward in my future studies and career. Thank you for listening to this portion, and we're about to go on and demonstrate the exercises that I have in my packet. Thank you for following me over to the gym portion of the clinic we're in. And I'm going to go over all the exercises that I have in my at-home informative packet. Starting with the sleeper stretch. The sleeper stretch is designed to increase internal rotation of the shoulder, specifically at the glenohumeral joint, by targeting tightness in the posterior capsule and associated soft tissues. The muscles and structures being stretched are the posterior joint capsule of the glenohumeral joint, the infraspinatus, the teres minor, the posterior deltoid, and the surrounding fascia and connective tissues. And to perform this stretch, you want to lay down on your side with your bottom arm out, creating a 90-degree angle. You want to tuck your opposing arm's thumb into your armpit, place the top elbow on the bottom hand, and apply more tension to that bottom hand until you get a nice stretch along the back side of your shoulder. Following this, we have the crossbody stretch. The crossbody stretch targets tightness in the posterior shoulder, aiming to improve horizontal adduction and internal rotation by stretching the posterior capsule and posterior shoulder muscles. The primary structures being stretched are the posterior joint capsule, the posterior deltoid, the infraspinatus, the teres minor, the latissimus dorsi indirectly, and the rhomboids if tightness is present in the mid and scapular area. And to perform this, you can do this lying down on the table, but for this video, I'll do it standing up. Take the arm you want to be stretched, put it across your chest, grab your shoulder with the other arm, and pull until you get a nice stretch along this backside. Following the crossbody stretch, we have the angel stretch. The angel stretch primarily targets the rhomboids and posterior shoulder, while providing a deep stretch of the posterior capsule. It's commonly used to improve internal rotation and overhead mobility. It targets the teres major, posterior deltoid, inferior glenohumeral ligament, and the posterior shoulder capsule. If my camera lady will so kindly bring the camera closer to me. How you want to get this going is you want to place your hands behind your back. I like to interlock my fingers, but you don't have to. You can make a fist and fist up like this. But I'm going to interlock my fingers, get my back up against the wall, and you want to push your elbows out and forward in front of your body, making kind of a chicken wing movement. And you should feel the stretch along this part of your shoulder down into your tricep. Following this, that ended the stretching and mobility portion of the packet. And after this, we have anterior and posterior scapular tipping. These movements aim to improve active control and mobility of the scapula on the rib cage, particularly in the sagittal plane. Anterior and posterior tipping are small but vital motions that influence how well the shoulder moves, especially during overhead motion, pushing, reaching, and day-to-day activities. These movements isolate the scapula's sagittal plane tilting, a key component of full, pain-free shoulder motion. The muscles involved in the posterior tipping are the lower trapezius, serratus anterior, and the rhomboids as stabilization. When anterior tipping, the muscles involved are the pec minor, levitator scapula, and weak serratus anterior often allows for excessive tipping. Now, to perform this, I'm going to show you guys my backside. You're going to put your hand directly on a wall in a nice neutral position. And I'm going to point the front half of my shoulder down to the floor for anterior tipping. So if this is my starting position, I'm going to roll my shoulder forward while keeping my hand firm on the wall, keeping my elbows straight and locked out. Then I'm going to roll it back into its natural position. And for posterior tipping, you're going to get in the same starting position, hand on the wall, elbow locked out. You're going to roll the back of your shoulder to point towards the floor. Elbow locked out, arm on the wall, and that's anterior and posterior tipping. Next, we have scapular elevation and depression. Scapular elevation and depression are basic but essential scapulothoracic movements that help retain shoulder blade control, improve posture, and support proper shoulder mechanics. These movements are fundamental in restoring upward, downward balance, reducing neck tension, and strengthening stabilizing muscles. The muscles involved with scapular elevation are the upper trapezius, levator scapulae, and the rhomboids. And the muscles involved in scapular depression are the lower trapezius, latissimus dorsi, the pectoralis minor, and the subclavis. Now, to perform scapular elevation and depression, you want to get in the same starting position as anterior and posterior tipping. So my hand's out on the wall in a nice neutral position, my elbows locked out, and all I'm going to want to do is point my shoulder to the ceiling. So you just want to raise it up. That's scapular elevation. Now back in the neutral position, and to do scapular depression, you want to point the shoulder blade down towards the floor. And that's scapular depression. After this, we have banded shoulder pulses. And the purpose of this is mini band raised pulses are a shoulder stability and endurance drill that targets the posterior shoulder, the rotator cuff, and scapular stabilizers. They're low impact, high rep, and great for developing neuromuscular control, especially in people recovering from shoulder injury or rebuilding overhead strength and postural integrity. The muscles targeted are the posterior deltoid, the infraspinatus and teres minor, the mid and lower trapezius, the rhomboids, the serratus anterior, and the rotator cuff muscles. Now, to perform this exercise, it really works if you have some sort of mini band at your disposal. You can go to Walmart and get one for about $5. And to do this, you want to put the band over top your wrists. You're in your normal starting position, hands out in front of your waist. And to start, you want to roll your shoulders back and pulsate the band out with your hands. Now, to perform this, once you start pulsating, you want to actively raise your arms up over top of your head, all while pulsating. And then you want to go back down while pulsating. And that's one. And then same thing, roll the shoulders back, keep going, pulsating all the way up, pulsating all the way down, just like that. Following this, we have side-lying external rotation. Now, side-lying external rotation is a foundational exercise to isolate and strengthen the infraspinatus and teres minor, two key external rotators of the shoulder. It's highly effective for building rotator cuff strength, improving shoulder joint stability, and addressing muscle imbalances, especially common after injury or in overhead athletes. The muscles targeted in this exercise are the infraspinatus, the teres minor, the supraspinatus, and the deltoid. And the joint and bone mechanics of this exercise is the glenohumeral external rotation, and the scapula remains relatively stable, allowing the rotator cuff to focus on rotating the humerus and maintaining glenohumeral centration. Now, to perform this exercise, if my lovely camera person would follow me over this table, you're gonna need a rolled up towel, and I have a dumbbell with me. You don't have to perform this with a dumbbell, but just for purposes, I'm going to have one for this. You want to get in a good side-lying position like so. Stick this rolled up towel. It doesn't have to be a towel. It can be a pillowcase, a blanket, or even a rag, but I just have a towel. You're going to stick that over top your hip. My top elbow is going to be resting on here. And this is the resting starting position. I'm going to grab my dumbbell. What I'm going to do is I'm going to pull the shoulder blade back and then rotate my arm up, keeping my elbow tight to my hip, squeezing in the back of my shoulder, just like so. And I'll show you a view from the back. So same thing, towel's going over top my hip, elbow's going on my hip, dumbbell in hand. What I'm going to do is roll the shoulder back and pull up using the back of my shoulder, squeezing at the top. Elbows glued to the hip, hold for a few seconds, then back down. Now, if you don't have a table that you can lay on, and if you don't have a towel or a pillowcase or a rag or blanket that you can use around your house, another way you can do something for the external rotation is you can sit down on the floor, on a bench, on a table, or anything like this. Prop your knee up, place your elbow on top of your knee, starting down. You want to pull up with the back of your shoulder, elbow still glued to the knee, hold for a few seconds, and back down. That's just a variation for those who may not have all of these things accessible to them. After this, we have an exercise called prone rowing to external rotation. The prone row to external rotation is a compound shoulder exercise that strengthens the mid and lower trapezius, rhomboids, and rotator cuff, especially the infraspinatus and teres minor. It is often used in physical therapy to correct scapular dyskinesis, improve posture, and restore functional shoulder mechanics. The muscles activated are the middle trapezius, the rhomboids, the posterior deltoid, and latissimus dorsi, along with the infraspinatus, the teres minor, the supraspinatus, the lower trapezius, the serratus anterior, and the joint movements of this exercise. You get scapular retraction during the row and glenohumeral external rotation during the second half of the movement. Now to perform this, I'm going to use a dumbbell. I'm going to slide this table back a little bit so I'm in view. Now I'm going to lay with my body at the top of the table. I'm going to have one side hanging off the table, and then with my other arm, I'm going to grip the other side of the table so I don't fall off. And what you want to do is you want to row upright, create a 90-degree angle between your arm and your body, and then you want to flip up at the elbow, squeezing in the back of your shoulder, hold for a few seconds, flip back down, and then release your arm back to the floor. Following this, we have 90-degree internal and external rotation isometric holds. These isometric exercises target the rotator cuff muscles, especially the subscapularis and infraspinatus and teres minor. This will build joint stability, postural control, and endurance at a functional shoulder angle of 90-degree abduction. This position mimics many overhead activities and is especially important for athletes or patients returning to sport. The muscles involved during the internal rotation hold are the subscapularis, the pec major, the latissimus dorsi, and the teres major. And during the external rotation hold, the muscles involved are the infraspinatus, the teres minor, and the posterior deltoid. Now, if my lovely camera lady would follow me over here to this wall, I'm going to start by performing the external 90-degree iso holds. So I'm going to find a wall or a post just like this. I'm going to put my body in front of it. I'm going to create a 90-degree angle with my arm, step back, so my arm is against the wall, and then I'm going to push back into the wall, hold for a few seconds, relax, push back into the wall, hold for a few seconds, and relax. Now to perform the internally rotated iso holds, all I'm going to do is put my body behind this post right here, create the same 90-degree angle with my arm, step into the wall. Then I'm going to push into the wall for a few seconds, holding, relax. Then I'm going to push into the wall again, holding, and relax. If you'll follow me back over here. Last but not least, we have banded external and internal raises. The purpose of this is the dynamic exercise brings the shoulder into flexion while targeting stabilization muscles, while tension is being placed in the external and internal direction. This builds joint strength, stability, endurance, and fluid functional shoulder movement. The muscles activated during this exercise are the anterior deltoid, the biceps brachii, the coracobrachialis, the serratus anterior, the upper and lower trapezius, the subscapularis, the teres major, the latissimus dorsi, the infraspinatus, the teres minor, and the posterior deltoid. Now, to perform this exercise, you're gonna have to go to Walmart. You get another little cheap $5 to $10 band right here. And you wanna hook it up to something so where it's at a down angle, just like so. And right now I'm gonna do the banded internal raises. So the tension of the band is pulling my hand towards a wall or a clip or a hook, whatever you're gonna have this on. What I'm gonna do is I'm gonna start with it by my side, create a 90-degree angle with my arm, and then using the shoulder, I'm gonna raise my arm. I'm not gonna let the tension of the band pull me out. I'm gonna be strong and firm and raise it up to where my elbow is in line with my head. And then I'm gonna go back down to the starting position, and that's one. Now, for the external banded holds, now to do the banded external raises, what you want is the band in your hand and the tension is pulling across your body. So what you're gonna do is the same thing, create a 90-degree angle, and then using the shoulder only, you wanna raise your arm up. Don't let the tension of the band pull your shoulder. You wanna be nice and firm. You wanna raise up till the band gets to about your nose. You want to go back down into the starting position, and there you go. And I want to thank you guys for watching this video and listening to my advanced at-home shoulder rehab packet. Thank you so much.